Hi, I'm Dr. B.
I'm so glad to see you.
Nice to meet you too. This is Kay. He's helping me out today. What brought you in to see us?
Well, I guess the whole story is that the police thought it'd be better if I was here.
Okay.
So
they brought you in?
Yeah, they brought me in.
Okay.
They put me in the back of the cruiser, and then I took a little joyride. I just relaxed in the back, and then they carried me in, and then they put me in here. And now you're here, and I'm here, and we're both here, and he's here, or yeah, we're all here.
So why did they put you in the police cruiser?
They didn't really like what I was doing. I liked what I was doing, but they didn't like what I was doing. So what I was doing is I was playing this game, and I went out this morning, and I was just taking a normal walk, and I was staying on the sidewalk, and then I decided, like, being on the sidewalk is not that fun. So I took myself off of the sidewalk, and I went into the street.
Okay.
And I ran around in the street, and the street was the morning, so it was a little bit busy. And there were a lot of cars, so I couldn't just like walk in the street. I had to like run between the cars because we decided to play this game. Me and these cars did. They would come at me, and then I would keep going at them, and we'd see who would stop first. I usually stopped first because like I know like cars are bigger, they're probably gonna win. So I would like dive out of the way whenever the cars got really close, and that was the game I was playing. And then I don't know why, but I think the police were just like driving by or something, and then they saw me and they didn't like the game. They probably didn't like that I was often losing. They thought it wasn't fair that the cars were always winning, so that's why they stopped. They thought it might like not be good for me to constantly lose the game.
Did you get hit by a car?
No, I didn't. I didn't hit the cars either.
Okay. Was anyone with you when you were doing this?
Nope, just me and the drivers in the cars. And I think there were like 3 squirrels that I saw earlier too. And because it was like in a neighborhoodish area that was busy. So there were squirrels and maybe some rabbits, because rabbits are typically in that area too, and birds.
So were you suicidal? Were you trying to hurt yourself?
No.
What do you think would have happened if the car would have hit you?
Well, I mean, that would have been bad, but technically the car would have killed me and not me.
Okay.
So that just means I'm not suicidal.
Okay.
I was just playing a game.
Any thoughts of wanting to hurt anyone else?
No. Why would I do that? I mean, I guess maybe like if I went through the windshield of the car, I could have hurt somebody. But like I'm so much littler than a car. So I probably they might have been scared or something, but I wouldn't have hurt anybody else. So I don't want to hurt anybody else.
Okay.
I just want to have fun.
And are you hearing any voices or seeing anything that's not there?
No.
Do you have any sensations of like bugs crawling on you or anything like that?
I did see a few bugs in this room.
Okay.
So if I could get a new room and lunch, that would be great.
We'll get you
So
some lunch.
I saw a bug like here.
Mm-hmm.
And there were a couple in the corner. I think there might have been a spider.
Okay.
So I'm a little bit concerned about getting a spider bite.
Okay.
Because I tend to have like really big reactions to spider bites, like really big welts. But then you could give me like medication. So maybe it's not that big of a deal. I'm okay with this room. I'll stay here.
Any IV drug use, like heroin or cocaine, alcohol?
So I did use cocaine yesterday.
What about today?
Oh, crap. What time was it? It might have gone past 12.
Did
so
you
I guess
sleep
technically.
at all last night?
Did I sleep at all? I think I had a couple dreams.
Is there any chance you could be pregnant?
I guess. Yeah, probably.
Okay. Have you had any other recent illnesses like fevers, cough, congestion, shortness of breath, chest pain, nausea, vomiting, diarrhea?
Yeah. So actually the fever part, what's like normal fever? I mean temperature or
like
fever?
98.6?
Yeah, I was like 95.
Okay.
Like 2 days ago.
How did you check your temperature?
I could just sense it.
Okay.
Well, I put my finger in my mouth, and like when it came out, it wasn't very red, so I just figured, what's normal temperature?
98.6?
I'm like 98.2 right now.
So you're
I can
pretty
tell.
close to normal.
Plus the nurse took it earlier, so I just listened to what she said. So that's really my safeguard. That's how I can tell that I knew that I was 95 degrees. Is that bad?
Well, I think there's other ways to take your temperature, so I wouldn't be relying on that.
Well, yeah. So I sat outside, and I think that warmed me up.
Okay,
So yeah, I had like an anti-fever.
Do you take any medications for anything?
I take the cocaine for fun.
But you don't take anything for like asthma or depression or anything?
My mom has all of those, and I mean, no, because I don't really want to go home. I just want to stay outside and keep having fun and go hang out with my friends. And if I go,
or do you live with your mom?
Well, I mean, I could live with my mom. She probably wants me to live with her, but if I step foot in the house, she's not gonna let me out.
Okay.
So she's gonna like lock me up and put me in a room and.
Is she here today?
What is this?
It's just a pocket for.
But it's like broken.
Yeah, there's a hole in it.
Oh.
Is your mom here today? Maybe we'll talk to her as well.
No, I didn't call her.
Yeah. Okay. Well, is it okay if we give her a call?
She's just gonna get mad at me. She's not gonna let us have any fun.
Well, we want to make sure you don't get hurt. Is it okay if I do a physical exam?
Yeah. Can I get lunch after that?
Yeah, we'll probably have to talk to the crisis worker.
Yeah, I just have like this horrible taste in my mouth.
Okay.
So I would love to get lunch. You said the crisis worker?
Mm-hmm.
Okay, are they gonna bring me lunch?
Well, I'll ask them about it.
Because I would love to talk. I would love to eat lunch with them.
Yeah.
That would be great. I would love that.
Take a deep breath. Deep breath. Any pain?
Nope.
Okay, go ahead and lean back.
This is really fun.
So her heartbeat is a little bit fast, probably about 110 on the monitor. No murmurs, rubs, or gallops. Lungs are clear. She's awake alert. Can you tell me your name?
My name is Kathleen.
Kathleen, what's your last name?
Myers.
Myers. And when's your date of birth?
August 17th, 1990.
Okay. And how many years young are you?
How many years young?
Like,
Usually that's like how many years old. I'm gonna be 26.
Okay. All right. When's your birthday again?
It was August 17th, 1990.
So that's almost coming up.
Yeah. Wait, I might be 25. I think I'm 25. Or am I 26?
Go ahead and lean back.
Wow, now I'm having like a crisis. I don't know if I know when my birthday is.
Open your mouth. Okay. Well, we can look and we'll look at the chart and we'll talk about it. So
my mom would know too.
Yeah, she'll know.
I mean, if she's coming, she might as well tell me.
We'll give her a call. Do you know her number?
Yeah.
Can you give me her name and number and I'll
So my name is Kathleen Myers. My mom's is Claire Myers.
Okay. What's
and her number is 878-432 1222.
1222. Okay. All right. So write that down and then we'll give her a call in a little bit. That tickle, sorry.
It's like a massage.
That's right. All right. Well, I'm glad you're feeling okay.
Thank you.
It seems like you may need to get a little bit of help just because we don't want you to get hurt walking in the street. So I'm going to talk to the crisis worker. We'll probably have to draw some routine tests and we'll go from there.
Like needles?
We'll probably have to put it in IV because we need to get some
Is that
blood.
going to give me a track mark? Because I don't do IV drugs because I don't want track marks.
Well, it's just temporary and it's medical, so I don't think it'll give you permanent track marks.
Okay, good.
Yeah. Do you have any other questions or concerns?
How long will it be until the crisis worker comes? Because I got really lonely when you were in here.
You know, if you need anything, you can just push the button. There's this little thing here, and you can just push that, and that'll call the nurse. So if you need to go to the bathroom or if you need any help with anything, you can just push that.
Perfect. Okay. Goodbye.
Okay. Bye-bye. If you can get some labs for me, we need a CBC, BMP, LFTs, TSH with a reflex T4, urine analysis, urine pregnancy, a urine drug screen, and a serum tox screen. Please consult the behavioral health assessment team. So the EKG shows sinus tachycardia. It was performed at 12:34 and read at 12:36. The sinus tachycardia with a rate of 110. It does have some QT prolongation. The QTC is 603. There's no ectopy. It is a normal QRS. Otherwise, there are some ST borderline depression in V5 and V6, which may be rate related. However, this also may be due to the history of cocaine use. There are no reciprocal changes. There is no prior for comparison.